documentaries before. I've written books, but what happened with Forks Over Knives is that this movie got a lot of attention. It was in the theaters for several months. The book came out in July. It immediately went to the top of the New York Times list, and it's been there for 28 weeks. And my goal when I started all this was not to be a film star or anything like that. It was to get the word out, and this has just turned out to be a really great way to do it. So what I'll talk about during the brief time I have with you this morning is just really what we know about diet. And I think the first part of it, the prevent, we'll talk about stopping and reversing disease. I think everybody knows that. The word's out. If you take care of yourself better, you reduce your risk of getting all the stuff you don't want to have happen, ranging from obesity to cancer. I think the part of the story that is missing is that we can even stop and reverse disease if we adopt the right diet. In other words, this could be used as an intervention tool in place of drugs and surgery in many cases. It's cheaper, it's better for a lot of reasons. And I'll give you a great example right here in Ohio. Dr. Caldwell Esselstyn is in the film. He's at the Cleveland Clinic where he spent most of his professional career. And he started out as a very traditional doctor. In fact, he was head of the breast cancer surgery unit at Cleveland Clinic for a very long time. And in 1985, he decided to do something very different. He took 24 patients who had advanced cardiovascular disease. They had, between them, experienced 49 events. 5 of them were told that they would not live until the end of 1985. And he put them on a whole foods, plant-based diet. And what happened was nothing short of spectacular. Their cholesterol dropped an average of 100 points. Chest pain pretty much went away. The disease progression had stopped, and in some patients with follow-up angiograms, they documented that the disease had reversed itself. And he wrote a book, and you can see the before and after images in the book. This is something that has never been accomplished with drugs or any procedures that we have available to us. So he was able to reverse disease in some cases, exercise capacity increased, sexual function restored. But I think the thing that was maybe the most astounding is that these patients never, the ones that were compliant on the diet, had another event. They took no more drugs. They had no more procedures. The 5 that were supposed to be dead in 1985 are still with us today. 2 of them were in the movie Forks Over Knives with me. And I think that in itself is a pretty amazing thing. Now, 6 patients dropped out of the study. And the reason that they did was they thought it was hard. And what happened to them was there were 4 angioplasties, 4 bypass surgeries, a congestive heart failure, and a death. And so there were 11 events in 6 patients who quit versus none in the 18 patients who were compliant. We don't really need to call in a statistician to evaluate the results and interpret them for us. I mean, 0 and 18. He's since gone on to repeat that success track record with 250 additional patients, and he's publishing another paper this year documenting similar successes with 250 more patients over the course of the last 20 years. The diet not only works on coronary artery disease, it works very well on diabetes. And I'll tell you the dietary parameters in a minute, but back in the 1980s, Dr. James Anderson at the University of Kentucky took 25 type 1 and 25 type 2 diabetics, and he put them on a whole foods, plant-based diet. And what happened was within 3 weeks, insulin needs for the type 1 diabetics went down by 40%, and their cholesterol dropped by 30%, 3 weeks. For the type 2 diabetics, 24 out of 25 were able to discontinue their insulin medications within 3 weeks. And that research has been duplicated by Dr. Neil Barnard, also in the movie with the Physicians Committee for Responsible Medicine. And he's proven time and time again that this whole foods, plant-based diet works better than the diet traditionally recommended by the American Diabetes Association for stopping and reversing disease. In terms of other conditions, really, I think everybody gets better when they adopt a better diet. And this works very well for all the chronic degenerative conditions. The only time we really can't help people is trauma and emergency. In other words, if you're in a car accident and you have an injury or a broken bone, I don't think giving you a baked potato is going to help a whole lot. We're really going to have to use the best of Western medicine at that point in time. But for the chronic degenerative conditions, which is, by the way, what we spend about 80% to 85% of our healthcare dollars on, diet works very, very well. So let's talk about the dietary parameters that comprise this diet. It is plant-based, meaning that 90% or more of calories come from the 4 major food groups, which are fruit, vegetables, whole grains, and legumes. 10% or less come from animal foods, and we define animal foods as anything that comes from something that has a face or a mother. So people ask about fish, well, faces and moms. How about eggs? They come from hens that have faces and moms, right? So anything that has a face or a mother. And animal foods are optional. And in some cases, I think a strong argument can be made, particularly in the event that somebody has advanced cardiovascular disease, that maybe no animal foods at all are needed. We advise people to get dairy out of the diet. It's probably the worst thing that people consume. Cow's milk has been linked to juvenile diabetes, asthma, allergies, constipation, chronic infections, multiple sclerosis, autoimmune diseases, osteoporosis, breast cancer, and prostate cancer. I guess other than that, it might not be such bad stuff. But we advise people to get the milk and cheese and cottage cheese and yogurt and ice cream, butter, all that stuff out of the diet. It's very low in fat. And one of the ways that we ratchet down fat consumption is to get oils out of the diet, which are also some of the worst things that people consume. And that usually surprises people. But I'll just take a second and talk about the oil issue, because I think it's a great example of some of the dietary myths out there that cause people to experience worsening health. The problem with oils is, first of all, that they're concentrated in fat and calories. I mean, 1 tablespoon of any type of oil has 130 calories and 14 grams of fat. And just to give you an idea of the weight-promoting potential of oil, if I were to add an oil-based salad dressing to my diet just once a day, by the end of this year I would weigh 36 pounds more than I do right now. And it's a pretty amazing effect, unless I took something out of the diet to compensate, or exercised more, did something to compensate for that calorie intake. The other thing is, we now know that oils contribute directly to the advancing of cardiovascular disease. We can do the brachial artery tourniquet test after consuming olive oil, and it's about the same level of blood flow constriction that you experience when you eat saturated fat. We also have direct evidence that monounsaturated and polyunsaturated fats contribute to atherosclerotic plaques as well. So I do actually a 2 or 3 hour workshop just on fats and oils, but get the oils out of the diet, which is usually, again, as I said, a little bit surprising to people. So that means olive oil and canola oil and palm oil, flax oil, fish oil, lotus oil, just to be clear, motor oil, in case anybody has any questions at all about the oil, all out. The diet's really high in fiber. The survey tells us within a couple of weeks of starting that this is a moving